Hitting record.
Oh, I have to.
Recording in progress.
I have to acknowledge
You
it.
have to consent.
Or it says leave the meeting. Listen them out. Hey, Vera.
Hey, Jessica.
Why is zinc one of our favorite things to prescribe for our patients?
Oh man, I was just talking to a patient about this earlier today. I love zinc for immune support, but I mostly think of it in a mental health context. You need zinc to be a precursor for a lot of the hormones that protect your brain and for some of the neurotransmitters that make you feel better and reduce anxiety and overwhelm. And a lot of people end up being too high in copper and too low in zinc. And I can't give you anti-copper, it doesn't work that way. So I can give you zinc to bring those to be more of a closer ratio.
And then you would expect to feel more balanced, less anxiety. What would you expect to notice as a difference?
It's different for each person, but I've had some people tell me that they feel more emotionally resilient. Like they can't explain it very effectively, but they're like, I'm just sort of better with my mood. And I've had some people notice a real difference with anxiety. And I've had a couple people notice nothing, and so they stop it. And then they notice that they stopped it because they're more anxious or more disorganized after that.
That's what I notice for myself personally in my routine is, oh, you didn't take this for a couple of days or a week.
Yep. And your brain gives you the feedback.
How
and usually
often is that something you do?
I screen almost everybody who comes into my office for a zinc and copper imbalance and for something called pyroluria, which is a hereditary way that bodies can be low in zinc. I would say maybe 25% of my patients have an imbalance that needs to be corrected with zinc and is effective. Sometimes it's too subtle and there's other therapies that we need to do instead or in addition. But for some people, it's really big bang for your buck. Like small amount of zinc goes a long way.
If a person with anxiety were to go to Fred Meyer and pick up zinc, appropriate, or do they need lab work to understand this imbalance?
Yeah, I would want to do labs. I would recommend labs before doing high dose zinc for long term, because it's possible to reverse that copper zinc imbalance and have it be too high zinc, which is a problem in the other direction. I often am dosing zinc fairly high, but I do it with labs. Like we do the labs beforehand and we do labs to monitor to make sure we're not overcorrecting.
So
if you're going to do zinc
environment.
Yeah, if you're going to do zinc over the counter, I would want you to consult with a doctor if you're going to do it long term or high dose, or stick with the lower doses and short term that you'll find in like immune supplements.
I also see a lot of literature around vitamin D and zinc as the natural solution for COVID. What say you?
Oh man, so we don't have much research on that, which is a real bummer. We've got a lot of research on pharmaceutical grade treatments and preventions for COVID, and there's a lot less research that is available right now on zinc and vitamin D.
Do we suppose that has to do with funding? We're less interested in studying it, or it's harder to control the variables?
I think that those are all factors. I can't really speak to it since I'm not a researcher, but in general, when a supplement is cheap and easy to obtain, there's going to be less research after the initial, like, we know your body needs this kind of research, because it's harder to monetize. There is some anecdata that people with higher vitamin D levels on labs are doing better with COVID. That was true last year. I'm not sure if it's still true now. So in general, I'm testing all of my patients for the copper and zinc balance and for vitamin D, just for mental health reasons. And there's also these potential immune benefits to making sure your vitamin D and zinc are doing okay.
So simple. Such a simple intervention. I love it.
Yep, me too.
Cool. And next week on Hey Vera.
Next week on Hey Vera, let's
what
talk
should
about,
we discuss?
I don't know.
Right, vitamin D.
Yeah, maybe we should talk about vitamin D. I will stop recording.